Okay, Dr. Rafich here from Vet Triage. We're continuing through this issue of veterinary surgery from May 2022, and today we are going to talk about horses, equine orthopedic surgery. This is the paper, The Influence of Screw Head Diameter on Ex Vivo Fixation of Equine Lateral Condylar Fractures with a 5.5 millimeter cortical screws. This paper is very technical, so for those who are interested in orthopedic surgery in general, like general orthopedic principles, this is a good paper for you, or for those who do perform equine orthopedic surgery, this is also useful for you. This paper comes out of Switzerland. The objective is to determine the influence of screw head diameter on equine condylar fracture fixation with 5.5 millimeter cortical screws. The design of the study's ex vivo biomechanical study blinded matched pair design. It included 15 pairs of equine third metacarpal MC3 bones. Methods: they had cortical screws of 8 millimeter head diameter, that's considered standard, and then the modified ones they're comparing it to are 10 millimeter head diameter. They tested the screw insertion torque to failure, they tested the quasi-static axial load to failure, and the cyclic axial load to do 2 millimeter displacement followed by failure. Then the first two tests, which is the screw insertion torque to failure and the quasi-static axial load to failure, were analyzed for yield, maximum, and failed torque per angle and load per displacement, respectively. The number of cycles to 2 millimeter displacement and failure was assessed from test number 3, which is the cyclic axial load to 2 millimeter displacement followed by failure. Results: the maximum insertion torque was greater and failure angle smaller when constructs were paired with the modified screws were tested. So 8.1 nanometers versus 8.1 nm versus 7.4 nm. I don't know what nm is. Newton nm. Let's see. We're gonna look this up in real time. Nm unit. Newton meter, a Newton meter. It measures the rotational effect of a force. Okay, so again, results: maximum insertion torque was greater and failure angle smaller when constructs were paired with the modified screws were tested. So 8.1 Newton meter versus 7.4 Newton meter, and then 550 versus 1,130. The axial yield, which is 7,118 newtons versus 5,740 newtons, and the failure load at 12,347 versus 8,695 newtons were greater for the modified screws, and there was no difference between the number of cycles to 2 millimeter displacement. The conclusion was that the condylar third metacarpal bone osteotomies were paired with a modified 5.5 millimeter cortical screw sustained greater maximum hand torque insertion, smaller insertion failure angle, and a 1.4-fold greater quasi-static failure force than those constructs were paired with the standard screws. Therefore, the use of modified screws with larger heads may improve fixation of condylar fractures in horses. All right, and we're going to go over this picture here soon, but this is the modified version with the larger screw head compared to the standard version, and this is the process in the study they used to test these screws, which is a pretty typical process for orthopedic studies like this. Introduction. In equine surgery, open reduction and internal fixation is associated with poor survival rates because of catastrophic failure of the repair, cyclic fatigue failure of the implant, or implant-associated infection resulting in construct failure. The condylar fractures of the third metacarpal and metatarsal bones represent one of the most common long bone fractures in athletic horses and one of the world-leading causes for euthanasia in thoroughbred race horses. When this fracture has a simple configuration, it can be repaired with screws applied in lag fashion. A very common technical error in fixation of condylar fractures is inadequate compression. Excellent interfragmentary compression at the level of the joint is essential for a favorable outcome and to minimize arthritis occurrence. The compression generated from a screw across the fracture is the reaction of the generated tensile strength along the length of the screw, which is derived from the torsional moment or torque applied to the screw during insertion. Many factors contribute to the torsional moment of a screw, such as the shaft design and resulting interface between the screw heads screw threads and the bone. One way for a screw to apply more interfragmentary compression by the insertion of a washer, which distributes the compressive force applied to the screw head over a larger cortical bone area, thereby allowing a more compression to be generated before intrusion of the washer through the cortex of the bone. However, the washer adds height to the screw head and could increase soft tissue impingement. In addition, the use of a washer could become mechanically weaker than a screw with a larger head when the bone has a more irregular shape, like the lateral condylar fossa, which has a concave curvature. In that case, creating a countersink depression to facilitate optimal sealing of the screw head would provide an enlarged contact area between the head and the bone. While using a washer could also allow for optimal implant seating if the bone's geometry is prepared to accommodate the implant shape. This is less practical because much cortical bone would have to be removed, which would likely reduce overall strength of the construct. This reduction in effective contact area between the washer and the bone is leading to an increased force per square millimeter applied to the bone directly in contact with the washer, and could lead to the weakening of the screw washer bone construct, increasing the risk of screw bending. The addition of a washer theoretically decreases the insertion torque of a screw made of the same metal by reducing the friction produced by the underhead contact with the receiving construct. When using traditional non-locked plate constructs, plate screw fixation requires compression between the plate and bone interface, which is reliant on the friction between the plate and bone to maintain stability. The magnitude of friction generated is equal to the coefficient of friction between the two surfaces multiplied by the normal force between them, and the normal force is proportional to the screw's insertional torque. The ability of a screw with larger screw head to generate a higher insertion torque could therefore increase the ability to obtain a stable construct. The dimension requirements for human surgical implants, including metal bone screws, are given by the International Organization of Standardization standards. Current cortical metal bone screws under the ISO 9268 requirement have a head diameter to nominal diameter, meaning the outside thread diameter ratio, between 1.7 to 2. Created for the veterinary market, the 5.5 millimeter large animal cortical screw has the same head diameter, 8 millimeter, as the 4.5 millimeter cortical screw. The head diameter to nominal diameter ratio is 1.45, which is lower than other commercially available veterinary cortical screws. Hence, the relatively small head diameter of the 5.5 millimeter large animal cortical screw could reduce the full potential of this implant by undermining its ability to produce interfragmentary compression. So the objective of this study is to determine the influence of screw head diameter on equine condylar fixation with a 5.5 millimeters cortical screw by comparing their biomechanical properties using the modified 5.5 millimeter cortical screws with a 10 millimeter head diameter. So that has a head diameter to nominal diameter ratio of 1.8 versus the currently commercially available standard 5.5 millimeter cortical screw for large animals. And this is what's shown in figure 1 over here. So in this figure here, they have stainless steel cortical screws with illustrations of their different head diameters, which is the yellow line. So that's right here, the yellow line here, and here it is again. To their normal diameters, outside thread diameter in blue. So there's the blue line there, which is indicated by the blue line right here for each of them. Boom, boom. So the new modified 5.5 millimeter, this is this one here, screw with a 10 millimeter head diameter, and then the standard 5.5 right here, 5.5 millimeter screw in the middle, and then the 4.5 standard cortical screw. And then notice that the head diameter 8 millimeters is the same for both of these, even though this screw is smaller than this one. Okay, materials and methods. Implants. Specimen instrumentation was performed with either the modified or standard 5.5 millimeter cortical screws, which were made of implant grade stainless steel alloy 316L. The standard screw possessed an 8 millimeter head diameter, resulting in a head diameter to nominal diameter ratio of 1.45. The modified screw was manufactured to have a 10 millimeter head diameter, resulting in a head diameter to nominal diameter ratio of 1.8, while keeping the same head height and screwdriver insert recess depth as a standard screw. That's what's showing here in this picture. So they're saying that even though there's a larger head On the modified screw, the hexagonal shape where you would use the screwdriver is staying the same. So keeping the same head height and screwdriver insert recess depth as a standard screw, both screw types inherit the same hexagonal screwdriver insert head recess type, which is a 3.5 millimeter hexagonal. For both screw types, the shaft possessed a nominal diameter, so an outside thread diameter of 5.5 millimeters, and a core diameter of 3.9 millimeters, and a pitch of 2 millimeter. Both screw types were fully threaded, non-self-drilling, and non-self-tapping. The screw length was oversized to 100 millimeters to assure bicortical fixation. So in these drawings here again, we have the modified screw head was designed with the same hexagonal screwdriver insert head recess, which is S. It's going to be small to see, but this is the S over here. 3.5 millimeter hexagonal. And then the screwdriver insert recess depth, which is the letter T. That's there right here. That's this length. And the head height, which is K. So that's right here, K. And then the modified screw shaft was designed with the same nominal diameter. So that's D1, 5.5 millimeter. That's right here. And then the core diameter, D2, is 3.9 millimeter. And then finally the pitch, which is 2.0 millimeter. And that's right there. That's the P right there. Okay. And then this drawing here shows the events. So you start with the horses, you extract the limbs, then the condylar fracture model, pairwise fracture repair, and then the non-destructive interfragmentary compression, and then you have testing done. So here's torque to failure right here, load cell and torque to failure, and then you have this here, which is fracture gap evaluation, which is then tested further with the axial load to failure here and the cyclic axial load to failure. And they have radiographs here, right there, showing the fracture. So A is the radiograph, B is the schematic, showing how they're going to create the fractures, and then this is computed tomography, CT evaluation of the equine limbs and the screws placed in there. And then the bottom here is the testing that they're doing on the limbs. So for this one, for the testing here, in A, that's torque to failure, and B is axial compression. And then here's the measurements. If folks who want those numbers there, we'll talk about them here in a minute. And there's a schematic again of the fixation. So results: the bone density of the specimens were 643 grams per centimeter cubed, CAHA. The chart, the significant values in that chart I just showed you, maximal manual insertion torque at newtons meter was 7.403 for standard screws and 8.141 for modified. And then the angular displacement at yield was 879.19 for standard and 463.01 for modified. And then the angular displacement at failure was 1,129.99 for standard and 550.13 for modified. For non-destructive interfragmentary compression and torque to failure, the specimens instrumented with modified screws underwent less angular displacement prior to yielding and failure torque than specimens inserted with standard screws. No difference was detected between the specimens in the interfragmentary compression before failure. All standard screws failed by stripping of the screwdriver insert recess, which was associated with sinking of the head into the bone, while all modified screws failed by screw fracture at the proximal shaft region. So those are the two pictures there. So in A, you have the standard screw failure where it sinked into the bone, and then for B, you have the modified screw failure where the screw head broke. For the quasi-static axial load to failure, the specimen stiffness and displacement associated with yield were not affected by the screw head, but the specimens repaired with modified screws showed a greater yield load compared to standard screws at 7.1 kilonewtons and 5.7 kilonewtons respectively. Specimens repaired with modified screws were able to tolerate more load before failure than standard screws at 12.3 kilonewtons versus 8.7 kilonewtons respectively. On average, the difference to load to failure was 3.6 kilonewtons, representing a 1.4-fold rise. A single axial failure occurred because of screw bending with comminuted bone breakage, and all specimens repaired with standard screws and 60% repaired with modified screws. Then you have another chart here for those who are interested, right there. And so that is showing that the yield load at kilonewtons was 5.7 for standard screws and 7.1 for modified. And then the failure load in kilonewtons, 8.7 for standard, 12.3 for modified. For cyclic load to failure, specimens repaired with modified screws sustained an average of 59,289 more cycles before 2 millimeter displacement than specimens repaired with standard screws, so 85,907 and 26,618. And then here, this picture right here, right there. So we'll go over that here in the gross picture A, that shows standard screws, and then the modified picture in B, after a single axial compression cycle, the standard screws failed by screw bending and comminuted bone breakage, and the modified screws failed by loosening and bending associated with a single fracture on the dorsal plane of the distal metacarpal 3 through a screw hole. And then the bottom figure with CT scan that shows the standard screws showed the standard distal screw broken at 2 locations, and the specimen repaired with the modified screws showed a partial failure of the third metacarpal bone, contralateral to the osteotomy fragment, and distal displacement of the screws from their original position without implant failure. So again, just to show you that. Okay, we're getting there, folks. Discussion. The study found that modified 5.5 millimeter cortical screws with a 10 millimeter head diameter placed in the lateral epicondylar fossa of equine metatarsal 3 bone can be inserted with a greater perceived maximum manual insertion torque and appeared less subject to head stripping or sinking into the bone compared to specimens instrumented with standard 5.5 cortical screw. The study's results suggested that the fracture fixation with modified screws has greater resistance against overload failures and equivalent resistance to development of a 2 millimeter articular incongruity under cyclic loading than the standard screws for equine complete uniarticular condylar metacarpal 3 fracture in the ex vivo model. The results of the study are believed to be applicable to other fractures, such as proximal phalanx fractures, treated with screws inserted in lag fashion and with minimal soft tissue coverage. The maximum insertion torque used for both screws placed in the study represents that perceived maximum torque that would provide the maximum interfragmentary compression without failure of the screw or bone screw interface, according to the experienced large animal surgeon. The finding confirms the usefulness of current surgical practices of hand tightening screws in equine patients to perceive maximum torque. The mean maximum torque required to reach screw failure, meaning stripping of the recess screwdriver insert of standard screws and failure of the proximal shaft of modified screws, was approximately 10 Newton meters, which would be difficult to achieve manually. The margin of safety for screw stripping or failure was therefore approximately 25% and 20% for screw insertion in the specimens with standard and modified screws, respectively. The manual torque achieved by the surgeon, meaning stopping torque, compared with the maximum possible torque or failure torque, representing the screw tightness for insertion, as a percentage of the maximum stopping torque was around 70 to 80% in this study. For human surgeons, cortical screws, which is 78%, for 4.5 millimeter cortical stainless steel screws at 84% to 88%. The insertion torque is a function of many factors, such as screw type, thread length, and bone porosity. Despite being below some of the previously recommended insertion torques of 5.5 millimeter cortical screw in large animal bones, 8 to 9.5 Newton meter, tightening to those high torque levels can cause damage, leading to compromised holding strength. Specimens instrumented with standard screws failed from stripping with the hex recess screwdriver inserts, which agrees with clinical observations of screw failure mechanism during surgical insertion in the equine bone. In clinical practice, the type of failure can also result from slippage and extrusion of the screwdriver tip from the screw recessed insert, leading to deformation. The modified screw failed by proximal shaft breakage and showed flat fracture surfaces perpendicular to the shaft axis, typical of torsion overload failure. During lag screw fixation, the friction created by the screw head and bone interface is critical in the relation between torque, so turning moment, and the preload or tension development, resulting in interfragmentary compression. The threads of a screw provide a mechanism that produces linear motion when rotated and can convert torsional forces into compression. This is achieved by the generation of tensile stress along the length of the screw that is derived from the torsional moment or torque introduced into the screw during insertion. During screw insertion, the level of screw compression achieved before stripping determines the amount of functional load possible, while still preserving the rigid fixation necessary for bone healing. When screws are placed in lag fashion, a direct linear relationship exists between screw insertion torque and bone fragment compression. The screw head provides a buttress to stop the screw head from entering the bone and is responsible for the friction between the underhead and bone. Using a screw with a larger head could permit the distribution of compressive force applied over a larger area, thereby allowing more compression to be generated. The compression achieved by the specimens instrumented with either screw type is similar or greater to currently used implants at 4.1 newtons, capable of showing clinical fracture healing. To maintain stability, non-locking plate screw fixation requires compression between the plate and the bone interface contingent on the friction between them. The magnitude of friction generated by the construct is equal to the coefficient of friction between the two surfaces, meaning plate and screws, multiplied by the normal force between them. Increasing a screw insertion torque also increases the friction generated by the construct. The load displacement curves obtained during axial load suggest the presence of a first yield point with an associated yield displacement around 0.5 millimeter, in addition to a second yield point used for data analysis in the study, identified using an offset curve at 2% displacement. The first yield point is likely associated with the yielding of the bone-to-bone interface, and the second yield point with screw deformation and yielding of the bone-screw interface. The screw diameter is responsible for the construct stiffness and yield strength. Specimens repaired with modified screws show a greater stiffness when compared to the standard screws. The greater contact surfaces of the modified screw head may have reduced their stress concentration that may arise at the bone-screw interface and lead to the greater yield load of the combined bone-screws construct. Specimens repaired with the modified screws tolerated 1.4 times greater monotonic load before failure versus specimens repaired with standard screws. The design of the modified screws conferred with them an expanded underhead surface resulting from their 2 millimeter head diameter increase. The use of a larger head may lead to an increased area of pressure under the screw head, which may decrease stress risers from the implant head for the same interfragmentary compression and may improve fracture stability. Specimens repaired with the modified screws show a lower comminuted bone breakage incidence than standard. On the other hand, creating a larger countersunk depression to accommodate the larger head of the modified screw could weaken the cortex, especially the cortex is thin, which could result in the screw head pulling completely through the cortex. The achieved mean failure load is less than the average axial load placed on metacarpal 3 during walking, which is 7.52 kilonewtons for 450 to 550 kilograms. However, 40% of the specimens repaired with the standard screws failed at less than 7.5 kilonewtons, while none of the specimens repaired with modified screws did. Degenerative joint disease following condylar fracture is a frequent complication caused by pre-existing intra-articular pathologies, often associated with a lateral condylar fracture or the result of postoperative complication secondary to articular incongruity. The mean activity of the forelimb is 190 steps per hour. The 3 kilonewton axial load was chosen to represent the vertical forces applied to equine limbs while rest or walking. This load also approximates half of the load sustained by both metacarpal 3 condyles at a walk. The larger head of the modified screws appears to reduce the susceptibility of the specimen to lateral displacement during eccentric loading of the osteotomy fragment or fracture gap opening by preventing sinkage of the head into the bone fragment during cyclical testing, while could also improve the resistance to the proximal displacement of this construct. On the other hand, the sinkage of the smaller screw head into the cortical bone observed after cyclic testing in the specimens repaired with standard screws suggests a progressive osteotomy gap opening during testing, resulting in the development of a greater bending moment, leading to fractures of the screws and bone. Based on the mean number of cycles until the end of the test and this loading rate, the repaired specimens undergo cyclic fatigue failure within 14 weeks, which should allow enough time for bone healing to occur before the implant fails in real horses. So in conclusion, the summary, the specimens instrumented with modified 5.5 millimeter screws with a 10 millimeter head diameter reached higher perceived maximum manual insertion torque, and their use for condylar fracture fixation may provide more post-operative shear stability and equivalent or greater resistance to development of articular congruity under cyclic loading compared with standard cortical screws. These results implied that the modified cortical screws placed in lag fashion for the fixation of condylar fractures in the equine cannon bone may provide better immediate postoperative stability to the shear of the bone screw interface and should be considered for further study. So let me just recap, because obviously it's very technical and a lot of folks find this stuff probably useless or boring. There's a few things. Number one, any fractures around a joint, like they're showing here, can cause problems for the horse or any animal, because by the joint you get arthritis, and also the repair is not perfect, then you also get arthritis. Secondly, usually around the joint, especially distal limbs, there's not a lot of soft tissue, and so you don't have a huge vascular supply, you don't have a lot of muscle, a lot of skin, so you have to have implants that are fairly flush to the bone, but also keep in mind the biology of the vasculature around that area is not going to be optimal. Also, you can see how much work goes into trying to figure out what the best fixation is for any repair type. I mean, they're literally created this entire complex study just to change the head diameter, and apparently just changing that one part of a screw does in fact help improve the strength of the fracture repair. So for equine surgeons, this is probably these are of course important findings for them. And then for horse owners, again, realize just the difficulty in repairing fractures. But even in general, for those who are non-equine, who provide orthopedic services to small animal, these factors are very important to fracture repair. So studies like this are really very important, even though they're very technical, and they only use 15 pairs of equine bones. I mean, so it's a small study, but still, it just shows the complexity of trying to figure out these things. But all these measurements, all these words being used here are required for surgery residents who are going to take their boards. So this stuff is very important to know, at least fundamentally, what these different forces indicate and all the factors that go into what creates a stable fracture fixation. All right, guys, thanks so much for watching the video, and we'll see you in the next one. Take care.